And one way of combating this thing is we have to increase our human resource workforce. So we have recalled all nurses, all doctors, all clinical officers who are undergoing postgraduate training to come back to Kilifi during this time of a pandemic of COVID-19. So far, like now, we've got 92 staff who have reported back by yesterday. And we are saying, so that we do not create shortages in the other service areas, like, for example, the wards, the hospitals, the dispensaries, and also other service areas. So we have decided as a department that the 92 people, healthcare workers, should be trained, and these 92 people will be trained on how to remove specimen, on how to manage, and how to take care of the COVID patients. And because these are a mixture of doctors, nurses, clinical officers, and out of these 92, by tomorrow we'll have a posting order to put them in the isolation facilities which we have identified. But we have identified schools, 2 schools in every sub-county, to act as quarantine facilities. Quarantine facility is a place where if somebody is suspected that you have somebody who tested positive, and then you do contact tracing, and this person says, I've been with A, B, C, and D. So those people, we need to trace them, get them, and put them somewhere. Yeah, while we take specimens to prove. If they are negative, they go home. If they are positive, then they have to be isolated. And here, this is a bit tricky, because quarantine, you cannot mix people who are negative and those who are positive. Okay? So we have to be very careful here when we say quarantine, because you might get a suspected case mixed with somebody also suspected, but one turns out negative, the other one turns out positive. So we have to be careful. So that's why we've chosen the schools where a person who fits a case definition is a highly suspicious. This one might be positive. Then we can put them, we can have one dormitory for that. And another dormitory where is somebody maybe in contact tracing, but most likely does not fit in the case definition, and maybe at less risk. So we separate them from those ones who we feel that they are at high risk. As you cross the bridge, you find women there selling their fruits and all that. So we need also to put some washing facilities there. Apart from that, we've embarked on disinfecting our towns, our offices. First of all, we went offices by offices, all the government offices, banks, the supermarket, Tuskies. By yesterday, we actually decided by evening we are taking the fire engines, because they're the ones which, put out a lot of water and clean especially the streets and the buildings. So that water is not only water plain, but it's chlorine added. Yeah, we've added chlorine to it so that we can disinfect all towns and especially the buildings. That exercise started yesterday, because that way you can capture a very big percentage of roads and towns. Our team, the rapid response team that has been formed, is very active, working very hard round the clock. And I would urge residents of Kilifi, even if there is a curfew, especially to the rural people, women who are pregnant, expectant, please, our facilities are working. the rumor that is going on that government facilities are closed is not true. Our dispensaries, our health centers, our hospitals are all working 24/7. And in case, as a lady, you are at home, you feel like you're having labor pains, call any of those hotline numbers to ask for help. We'll send an ambulance for you to be picked so that you can deliver in the hospital. Just in case you complicate, we can take care of you. So I want that message to go kwa wananchi clearly. Tafadhalini nawaomba akina mama wajawazito, hasa sija kama mmeingia na mshtuko kwamba ikifika saa 1 kuna curfew, hamfai kutoka, mkitoka mtapigwa na polisi ya siku ya hayo. Tafadhalini, hotline zetu mko nazo, pigeni simu katika hizo hotlines, muitishe msaada pale huko. Ni rahisi sisi kukupeletea gari. Kama huko sehemu za Bamba, tuna ambulance Bamba. Kama ni Marafa, kuna ambulance Marafa. Garashi kuna ambulance. Mareni kuna ambulance. Vitengeni kuna ambulance. Jibana kuna ambulance. Rabai kuna ambulance. So, huku kote ambulances hazikosekani. Tukijua mama wewe ni mjamzito, uko in labor pains, tafadhali usifanye wasiwasi, piga simu tukuchukue uzalie katika hospitali.
Maybe we can do a subject camera.
Yeah, you can do set footage area followed by see experience of negative. Sure.
Yeah.